really, we're recording. We are really fortunate to have our county executive here with us today. So I'm going to do some brief introductions for about a minute, and then really happy to welcome our county executive, Ken Jenkins. So this is the first program of the 2025 Community Assets Series, which is designed to connect employers, employees, and our community to the wealth of resources in our county that are offered by both Westchester County, the nonprofit sector, and the business sector. And this series is designed to optimize family and community well-being and positive connections to the workplace. This series is a collaboration between Nonprofit Westchester, the Westchester County Association, and the Westchester County Department of Community Mental Health. And I'll be introducing people from those organizations soon. We really appreciate funding from Westchester County and the Board of Legislators to make this happen. Our focus this year is on mental health and wellness. The subject matter can be intense, but it is serious and it is important. And we are going to start with a presentation on suicide prevention and the 988 crisis Lifeline. And then we're going to have a panel discussion on workplace wellness. We are really so fortunate to live in a county that prioritizes this work. And before I introduce my colleagues for today's program, I am honored to welcome our county executive, Ken Jenkins. Welcome.
Oh, Jan, thank you so much, and welcome. Good afternoon, everybody. And it's certainly an honor and a privilege to be here this afternoon. We want to first start by thanking our Westchester County Association, Mike Romita and the team, and nonprofit Westchester, Jan Fisher and your team for bringing us all together today, for partnering with our county's Department of Community Mental Health, Michael Orth and the team there as well. This series is going to provide crucial support for our nonprofits, businesses, community leaders, families, and their individuals, along with providing residents with the tools and knowledge necessary to address some of the most pressing challenges facing Westchester. We all know that mental health is not a side issue or a private struggle that sits in the background. It's a public health issue that affects every community. 1 in 5 adults experiences a mental illness each year. Suicide continues to be the second leading cause of death among young people. 1 in 20 Americans experience a serious mental health condition. And these numbers are reminders that our neighbors, coworkers, classmates, and family members carry burdens that are often unseen. That's why the work highlighted in this series matters so much. Suicide prevention training, cultural competency workshops, and mental health first aid are life-saving tools. They help us recognize the signs of distress, reduce stigma, and respond with care instead of judgment. These trainings empower community members to step in with confidence when someone is struggling. We know that early interventions can prevent crisis, and that raising awareness can change outcomes, and Westchester County is committed to supporting this work. Our outstanding Department of Community Mental Health continues to focus on improving access to care, strengthening community partnerships, and expanding those resources, even in difficult times, to help families navigate through these situations. I am proud of the clinicians, our counselors, our program leaders, and community advocates who show up every day with compassion and determination. I want to thank the presenters and facilitators who are leading today's session. And lastly, I want to thank all of you that are participating. Everyone here plays a role in building a county where mental health is openly discussed, where resources are accessible for all, and where people feel supported when they speak up about their struggles. Thank you again for the work you do every day to support the well-being of Westchester residents. I look forward to continuing our efforts to build a future where every person feels seen, supported, and connected to the help they need. Thanks so much, Jan.
And we thank you. It is really refreshing and important to have your leadership here in the county to address issues that impact all of us. I'm sure I speak for everybody on this Zoom when I say we really, really appreciate you and we look forward to working with you in the coming year as well.
Thank you.
Thank you so much. So I'm going to now take the opportunity to introduce the people that will be presenting today. Again, we have Michael Orth, the Commissioner of Community Mental Health. We have Angela Jacobs, Program Director, Crisis Prevention and Response Team from St. Vincent's Hospital. Tanika Natal, the Director of HR and Administration from Cuddy and Fader, and Michael Romita, CEO from the Westchester County Association. This has been an incredible experience partnering with business, a business member organization like the Westchester County Association, who truly understands the importance of this subject matter and went all in to support this initiative. So we're going to hear from Michael Orth, then Michael Romita, and then Angela. So Michael Orth, welcome.
Well, thank you, Jan, and thank you so many of you for joining us today. I want to thank our sponsors and all of you just for being part of this conversation. And just to echo what Jan said, we have a county executive who has been so supportive of the work that we're doing in mental health. He ran a roundtable for businesses a few weeks ago. So we'll continue this charge and make it a priority for Westchester County. So let me just begin by why this topic is so important. And just to kind of set the stage a little bit, on the average, people experiencing a psychiatric distress wait over 10 years from the first onset of symptoms to first make contact with a general medical doctor. And it takes almost 11 years until the first contact with a mental health professional. So just imagine if you had a broken leg or a heart condition, would we want our loved ones or friends or even ourselves to wait this long? Add to that, only 20 to 30% of adults experiencing mental health symptoms actually seek professional help at all. So why is that? Maybe they don't know how to access care, maybe lack of insurance or other options.
Oh, Michael, we lost you. Michael, you're on mute.
Okay, do you hear me now?
Yes.
You must have put me on mute. Again, why is this topic so important? I started talking a little bit about the average person waits almost 10 years till they even see someone as a general practitioner, and 11 years until they seek a mental health professional. So just imagine if you had a broken leg or heart condition and you waited this long. As the county executive said, that's why early intervention and supporting is so critical. And the reality is only 20 to 30% of adults who experiencing mental health issues or symptoms seek professional help at all. So is it because they don't know how to access care? Is it lack of insurance, or is it stigma related to mental health? These are our family members, our friends, our neighbors, people who attend our houses of worship, who go to school with our kids. And yes, they're also our employees in our businesses. Because adults spend such a large portion of their day at work, employers, and that includes the private, nonprofit, government, are uniquely positioned, as schools are for children, to not only support, but prevent, help identify, and respond to the mental health needs. So the role, and I would add responsibility and benefits of businesses of work promoting mental health and wellness in the workplace is really, and we'll talk more about it today, is creating a supportive organization culture that normalizes mental health and reduces stigma, that builds policies that promote mental well-being, that also train their supervisors and managers on mental health and wellness. And we'll give some examples later, provide access to services and support such as 988, and also understanding the key outcomes and benefits to employers as well. Higher productivity and engagement, lower turnover and burnout, reduced disability claims, and stronger recruitment and attention. So our county is really making a focus on reaching those sectors like the business community, like the faith-based community, our universities, our schools. So many of these people are credible messengers, and our goal is to provide the skills and access to resources that help us all support our residents and their mental health and well-being. So again, we look forward to the panel and dialogue, and thank you for being here.
Thank you, Michael. Now we're going to welcome Michael Orth, who really got this collaboration rolling. So thank you, Michael, and happy to introduce Michael Romita, the CEO of the Westchester County Association.
Thanks, Jan, and it's good to see so many people on the Zoom today. Look, Michael Orth really got a lot of the business stuff down, and Westchester has all of these amazing resources to help people who are in crisis. Congratulations to Ken Jenkins, by the way, for recently being elected to his first full term. Ken, glad to have you back and looking forward to partnering with you going forward. Ken brought all of the stakeholders together from the business community and the nonprofit community together recently. And his message was pretty simple. Look, the county has all of these fantastic resources, but we need your help in messaging out to let people know that these resources exist. So please think about what you can do to help the county spread the word and make sure that these resources, which are so important, are utilized. So I did what I always do when I'm looking for help. I called Jan Fisher and I said, Jan, we really need to do something about this. And her response was pretty poignant. She's like, Michael, you know, we're kind of already doing this, so I'm glad you called. And let's put together a program to make this happen. The other panelists are certainly the experts here. I am not the expert on mental health, but I can tell you that we often do a lot of different kinds of programming. We do specific programs on healthcare. We have an initiative called All Access Healthcare. We recently did, and these are in person, they're live events, and we recently did one on mental health where we brought in authorities from some of our regional providers. And this event alone drew more than twice as many folks as we normally draw, which was eye-opening and a surprise to us. And as Mike Orth said, this issue needs to be destigmatized and normalized. It's out there whether we address it or not. Certainly, those folks who do business consulting for a living have put out reports consistently on this. So they are really kind of front and center on this. Some quick numbers, over 60%, close to 70% of employees report that they are either moderately or high stressed or under unsustainable stress in the workforce. In the workplace. That's almost 70% of your employees are reporting that they are under moderate or high levels of stress. So whether you recognize it or not, as a business leader, it is out there. The incident of burnout in the workplace is almost 30%. So again, this is happening whether you appreciate it or not in the workplace. And you know, the importance should be self-evident. Good employee mental health increases productivity. It reduces absenteeism and turnover, improves employee engagement and satisfaction. This simply isn't feel-good stuff. No matter the size of your organization, these things will drive financial success. And I can share, you know, personally in my family, we certainly have a history of anxiety, depression, ADHD, and various types of neurodivergence. I expect that we are not alone. So even though I run an organization and I'm ostensibly kind of the boss here, I am not immune to mental health and stress either. And so the more that we can normalize this in the workplace and let people know that it's important, I think the better off we will all be. So with that, back to the experts. Thanks, Jan.
Wow, thank you so much for sharing that, Michael. And now we are going to have Angela Jacobs from St. Vincent's do a presentation on the 988 crisis line. Angela?
Oh, thank you for having me. I'm going to go ahead and share some slides for everyone to guide me along the way. Can we see the slides?
We see them.
All right, great. Just chat here. All right, so my name is Angela Jacobs. I am the program director for the Crisis and Prevention and Response Team based out of St. Vincent's Hospital. We are the 988 call center for Westchester County. So we are the designated call center for 988. So what I'd like to do is, first question I always like to start with is, before you registered for this workshop today, had you heard about 988? So I'm going to use the chat, little interactive. Had you heard about 988 before registering for this chat today? And pull up my chat. Great, lots of yeses, lots of yeses. Okay, a couple of no's, lots of yeses. So that's great. That's what I love to see. Lots of yeses strolling in, and no, that's okay because we're here to educate you on it. What is 988? 988 is a free and confidential service nationwide. Okay, you can call and you can text 24 hours, 7 days a week. The calls come directly into us here at St. Vincent's Hospital at the designated call center. Calls are geo-routed, similar to when you call 911. This is the 3-digit number for behavioral health. It's routed on your location. All major carriers come straight to our office here at St. Vincent's. You'll speak to a trained crisis counselor. Well, what's a trained crisis counselor? So I'm not going to read every word on this slide, but all crisis counselors are receive 40 or more hours of training here in person in our office. We don't do big group trainings, we do individual training. So it's you and a licensed clinician training at the same time. Our office is comprised of licensed social workers, licensed mental health counselors. We have a psychiatrist on our team. We have bachelor's level crisis counselors, and we have volunteers, and everyone goes through this extensive 40-hour or more training. And the best part about it is that it's all in person. From 7:30 in the morning to 11:30 at night, we are here in person working together on these calls. The rest of the time we're remote for the overnight, but that's what makes our call center unique as opposed to many of the other call centers nationwide. We are here doing this work in person, and that's really unique to us. That makes us stand above the others. So my second question to you in the chat is, do you have to be suicidal to call 988? It's in the heading, the 988 Suicide and Crisis Lifeline. Do we think we have to be suicidal to call 988? Perfect. Loving the no's flooding in through the chat. So that's great to see. Right, because the answer is no. You do not have to be suicidal to call 988. What do you think are the leading reasons why people call? What do you think are some of the top reasons? Go ahead and put that in the chat too. What are some reasons, the leading reasons why you think people call? Loneliness, depression, lots of loneliness and depression coming in, suicidal ideation. Great. All those are perfect types of calls. Perfect. Stress, anxiety, panic attacks, loneliness again. Well, you guys are hitting it right on the head there, because our top 5 concerns for people calling in month after month is anxiety, depression, loneliness, stress related, and family and relationship concerns. It could be, we get a lot of calls for people who just had a breakup and they're struggling with that breakup, and they give us a call. No suicidal thoughts at all. In fact, suicide isn't among the top 5 reasons. It's important for people to understand, and for us to express this to in the workplace and to our family and loved ones, that a crisis is different for everyone. Each person on this call, a crisis might be different for me, and a crisis is different for you, and it's different for your neighbor, and everybody needs that space, and everybody needs that support, a place where you can speak and be heard, have someone listening who's not judging you on the other end. So good job with that in the chat. You guys definitely nailed it there. One of the many questions that we get is there the LGBTQ plus line? There used to be the LGBTQ plus line, however, funding was cut for that. What they have done instead is increase the training. So all of the crisis counselors have received additional training so that we can receive those calls and that we could make the proper referrals into the community as needed. Another question that comes about, is there a veterans line? And in fact, there is a specialized line. So when you pick up the phone and you dial those 3 numbers, the very first statement they're going to say is you can press 1 if you would like to reach the Veterans Crisis Lifeline. We also speak to veterans in our office as well. They don't always want to push 1. They also want to talk to us. That's fine too, but just know that there is that other specialized line there for those services, and they really have the extensive resources to share. Other languages, that's another question that we get. 988 can accommodate all languages. When you call in, they're going to also give you the option to press 2. So you have 1 for veterans, and then you have option number 2 for Spanish speakers. Now, if you need another language and you go through, we are fortunate enough to have translation services with trained translators so that we can accommodate anyone that's calling us. I see there is a question for ASL users, and I do believe that 988 can accommodate that. We cannot accommodate that in our office, but I do believe that there is a separate service through Vibrant Behavioral Health that can accommodate that. So just to talk about some statistics, people kind of love to hear how many calls are you answering within 988. You could probably maybe in the chat, go ahead and guess. We did a trivia question here on National 988 Day. How many calls do you think the 988 call center got for Westchester County for last year? So for the entire year, how many calls do you think that the 988 call center received in Westchester County? 10,000, 8,000, 2,000. So it's rolling in. So last year, 2024, our call center received over 17,000 calls for Westchester County. Since we started here answering the calls in 2022, when 988 launched, we have received over 40,000 calls. And we see how large Westchester County is. We think that we could probably double this in calls if you think about the stress that people go through on a given day. So over 40,000 calls since we started. Now, I do see a question in there about human trafficking. They don't have a specific training for that yet, but fortunately, we utilize the resources in the community for proper referrals to the proper places. Some other data I wanted to share. We talked about the top 5 reasons why people have been calling. So the question is, then how many people are calling with suicidal thoughts? And so about 2% of our callers, so 2% of that number that we spoke about, 2% have expressed to us suicidal ideation. Less than 1% of the calls that we receive require an active, what we call an active rescue, or involvement with police and ambulance. So less than 1% of the calls require that intervention. What happens to the rest? We resolve it on the call itself. We don't need to get any emergency services there. What we do, since we're fortunate enough to be housed within a crisis team, we have the ability to dispatch our own crisis team, and we have a relationship with the county, and we can pursue dispatch of the other mobile crisis teams that are affiliated throughout all the police departments in Westchester County. So we have a direct relationship that we can help dispatching those teams for these cases, for these 1%. Does 988 connect to other resources? And of course, the answer is yes, we do. As mentioned, in the beginning of this presentation, Westchester County has a wealth of resources. People don't know where to begin. They don't know where to start. 988 is a really good place for you to start when you don't know where to go. You don't know how to navigate this system. So you call into 988 and we can provide you with the list of resources for whatever it is you're looking for in the community. We can refer, like I said, directly to our mobile crisis team here at St. Vincent's Hospital. And another unique service that we provide is what we call follow-up. So with the caller's consent, we say, you know what, you're really struggling with this. Can we give you a call back tonight to check in with you, to follow up with you? Or can we give you a call back tomorrow to check in with you, follow up with you, see how you're doing, check in on that safety plan we just created. So with their consent, we'll call them that evening or the next day, and we'll call them as many times as it takes to provide them with the support that they need. Not everyone is ready at the time of the call. It takes that extra follow-up to hopefully help engage them. So I was going to do a quick pause for questions, but instead I'm going to pause the questions for the end, and we'll get there at the end. So thanks for your patience with that. to change the focus a bit, and talk about, it was mentioned by a couple of people already, is what are some things, or what is something, or what is a major thing that would prevent people from reaching out for help? What do we think is something that might prevent people? You can go ahead and use the chat. Something that might prevent people from reaching out for help. Stigma, immigration status, right? Stigma, fear, not aware. Yep, being judged, ignorance, trust issues. Yeah, all really great answers. And from the very first person that put it in was stigma. And so that's the one I wanted to touch on today. All great answers. A lot of them have to do with stigma itself. A lot of other good answers as well. Just to touch on one of the answers in the chat, that experiences with emergency services, something that is important to know is that this is the free confidential line, and majority of folks who call, we're not asking them their name, their address. It's only for those 1% or less. That's the time when we have to go ahead and figure out how to help them. But otherwise, people are calling and remaining anonymous. So people appreciate that. But stigma, that's the one. That's the one I wanted to address. First person in the chat said stigma. So that's the first one that I wanted to address. What is stigma? Perhaps everyone on this call already knows, but just in case, negative beliefs around mental health, fear of being judged. And who's judging me? Maybe it's society. Maybe it's my family, my friends. Maybe it's myself. I'm judging myself. So that's what stigma is. And that's what we need to, that's what we need to break. That's what we need to address. Reduce the stigma, promote empathy and connection, help people seeking help as a strength and not a weakness. So really just normalizing the conversation. The more that we talk about it, the more that we talk about it here in this more of a professional setting, the more that we talk about it at home or in the workplace, and normalize it, that it's okay. It's okay to get help. It's okay not to be okay. And that's important for people to know that they don't have to be alone. Also want to touch upon a couple other things that were mentioned about culture of support in the workplace. This is where we spend most of our time, in the workplace. This is where signs of distress often first appear. So if we can work to destigmatize that, perhaps we can save a life, improve someone's overall well-being, improve retention, improve productivity. So I, again, want to change gears. And what I'm going to do now is I'm going to just share some real life 988 stories. Of course, names and locations, of course, are kept out of it. But these are just a few of the more recent stories that some of the counselors have shared with me here. So I just want to go ahead and share some of those with you. And most of them will be brief, but time for questions at the end. A call that we get a lot is a parent calling about their adult child. One of the more recent ones was a mother calling about their adult child who was, he's acting bizarre. He's talking to himself, sharing us all these symptoms of what's going on. What do I do? Talk her through the conversation. We deployed our crisis team here at St. Vincent's, and they go straight to the home and they meet with the family. So that's something that we experience a lot. Parents calling about minor and adult children. We recently had a male caller call in about a breakup with his girlfriend. He was having suicidal thoughts, and there was a plan, and the plan was to drive to the Kensico Dam. And unfortunately, we've had that call more than once on the line, and we've had a good success rate. We work really well with the police departments in the county. We work well with the county police and the police located at the Kensico Dam, and in all cases, we were able to find these individuals. So that was another example. Another example of a call that we get a lot is perhaps someone who's unemployed, male caller, unemployed, hasn't been able to find a job, supporting his family, his 2 young children, calling tearful at the time. I believe this caller had passive suicidal thoughts, felt like he was being a burden, had no one to confide into, trouble sleeping, feeling depressed. This is a common call that we get, and fortunately, this person reached out for help. Couple other calls I'll share with you as well before we get into questions. This call I actually took myself, so I thought it would be good to share. First thing in the morning when I arrived to work at 7 a.m., a female caller in her 40s just got off her overnight shift at the hospital. Can't imagine working overnights. I wouldn't be able to do it, but here she is at her overnight shift, parked a few blocks away from her home, stated she no longer wanted to live, and this call was fairly intense. Caller was drinking and taking pills and just wanted someone to be on the phone with her during this process. And we were on the phone for over an hour until the police were able to find her and then safely escort her to the hospital. But so these are just some of the examples. And then I'm going to go ahead and wrap it up. But I did want people to know that we are also getting calls from children. A minor calling about a classmate. Fortunately, we found out what school they were in, posting things on social media. Another common call that we get, and in this case, we were able to find the child. Sixth grader calling because they were being bullied. So another common call that we get. So I'm going to end with this one. This is my last one. Thank you for bearing with me. Middle-aged male gave us a call, opened up his email that morning, found out he lost his job, was starting to have a panic attack in his car. He gave us a call. We saw him immediately on the crisis team and referred him to our partial hospitalization program here at St. Vincent's. And the most important thing that I wanted to share about this call is that this caller found out about 988 from a sign posted in a local shopping center. So to make a segue of conversation, and hopefully we'll talk about it in the panel, is you know, how can the community help? All parts of the community. How can we all join in and help the community and help everyone? I was really excited to see this weekend. I live in northern Westchester, and for the first time, I made my Amazon return at Staples, and on the way out, I saw my very first 988 sign right under the stop sign, and I was excited to see that it's really spreading across the county. So thank you for having me, and I hope we can all work together to spread the awareness. And I believe we're going to take some questions.
Yeah, thank you so much, Angela. That was really, really informative, and I look forward to getting into the panel conversation. But we do have a couple of questions, so let me share those with you, and then we'll go in. Who responds to the 988 texts?
So the 988 texting is answered statewide. So it's not just answered locally here in our office, it's answered by a unified state platform. Right now, they are working to pass the legislation that's needed to get the chats and the messages geo-routed like the calls. So currently it's answered by just a large New York entity. So it's other local call centers. One of the largest ones is out in Suffolk County. They answer a lot of the text messaging. And soon, hopefully, it'll be here at St. Vincent's.
There's some more questions coming in. What programs does New York State or Westchester County have for small business owners discussing mental health issues and providing assistance to their employees before it's too late and being proactive? Michael, do you want to answer that one?
Yeah, absolutely. There's a couple of opportunities. One is, we'll talk about a little bit more later, but mental health first aid in the workplace. It's a great national evidence-based training for employees, organization, businesses of all sizes. So we're going to share a little bit more information about that later. Also, the Westchester Human Resource Management Association, WHRMA, that works with HR providers and professionals, employee assistance programs. Westchester has our own EAP program for county government and municipalities, but we can also share materials. So there really is lots of training, but also contacts to help support creating a more robust training and be able to respond to employees' mental health needs and wellness needs.
And we certainly will be discussing that more. So I have two more questions and then we'll go into the panel discussion. Will more signs be posted on highways, major roadways, near schools, etc.?
Well, my answer is I hope so. We're really trying to work with the entire county to spread the word as much as possible. So I'm hopeful that it will be. Michael, I don't know if you have anything to add on that one.
Yeah, all the state universities already have the 988 on their ID cards. Thanks to our county executive and our meeting we had with WCA and nonprofit Westchester. They're printing posters for restaurants, other places where people frequently attend, including signage at parking lots. We want to be respectful of the municipalities and the owners of those facilities, but we are definitely going to reach out and offer. So if you know of anyone who's interested, who has some sort of platform to do so, we will get you the 988 information cards and posters.
Okay, and the last question before we go into the panel conversation is, do 988 calls go to St. Vincent's?
So the St. Vincent's Crisis Prevention and Response Team, we house the 988 call center. So there are designated 988 staff who are housed within here and supervised by the St. Vincent's team. So hope that's.
I do want to ask one more question because I think it's important. When callers receive referrals for therapists, often they ask for credit card in addition to insurance. Is there a way to change that? Some people don't have that.
That's I haven't heard that before about asking for a credit card. I know we certainly don't do that here at St. Vincent's. It's unfortunate to hear that that's happening to people.
Okay, so we're going to go into the panel conversation, which I'm going to be facilitating. The one person we have not seen on the screen, and I would just like for her to say hello, is my colleague and friend, Tanika Natal. She's the Director of HR and Administration at Cuddy and Fader, and really lucky to have somebody, a professional in this space who also happens to be a really caring and wonderful person as well, from a top law firm and business here in Westchester County. So hi, Tanika, say hi. You're on mute. You're still on mute.
Okay, am I here now? Okay, great.
Yes.
Perfect. Thank you so much. Wow, just listening to the intro, my heart is very heavy because this is a very, very meaningful topic. And it's important that we gather and collaborate and address the issue. I'd like to thank you, Jan, first of all, for the privilege of me being here. I'd like to thank my co-panelists and all participants who share in this discussion covering such a meaningful topic. And thank you to County Executive Jenkins for your ongoing support, and congratulations on your victory. So, the workplace is, you're all correct in terms of how much time people spend in the workplace. And if you don't mind, Jan, if I could just dive right in. I don't know if you want to ask me the questions or should I just kind of.
I'm gonna frame the question and then have you
Okay.
dive right in, because we did prepare for this, and I do want to thank all the
Yes.
panelists. We have Michael Orth, Michael Romita, Angela, again with us, and Tanika, who are going to be here answering the questions. But we wanted to make this most meaningful for everyone, so we did prepare. And
Perfect.
the first question was, what concrete steps can leaders and HR teams take to create a culture where employees feel safe, seeking help without fear of professional repercussions? And what are the most effective ways HR and employee assistance programs can reach employees early, communicate confidentially, and integrate mental health support into everyday life, not just in a moment of crisis? So this is really supporting people to speak up about their struggles and to seek help without fear of losing their jobs or other repercussions. Tanika, we will definitely start with you. And I know, Michael Orth, you have a few things to say in this area as well. But go ahead, Tanika, please.
Thank you. Thank you. Well, first of all, I'd like to say I'm very fortunate to be at a firm such as Cuddy and Fader in its support of its people. It's very important that leadership and HR teams are aligned in their commitment to support the well-being of its organization. Support that's demonstrated by leadership and HR teams have a meaningful impact on employees when they are tuned into the pulse of the organization and the people, to be there in the highs and the lows. I particularly, and members of my team, we're believers in cultivating relationships that build trust. And a topic such as suicide or mental health struggles, trust is very important for anyone to be able to come into your room and say, I'm having a problem. And I believe that if you cultivate that kind of relationship with your people, then it's easier for them to come and say, I need help. You do not mix performance reviews with mental health struggles. You remain consistent in your career opportunities and in your decision making initiatives. And also, if people are in danger and other members of the organization, such as a coworker, a friend, a colleague, they come in and say, "Hey, listen, I think someone is having trouble." You intervene in a confidential, in a way that bears confidentiality and support and empathy. I think that also tells the workplace, it shows the workplace community, excuse me, that the firm cares, the organization, the business cares. And in any organization, I'm sure everyone can agree, there's always a rumor mill. I always say, let the rumor mill speak loudly for a good cause. And that's where I stand when it comes to building trust in your organization, so that there is a place where people can go and they can seek help. Um, I think it's important that we remain consistent in our resources, our EAP programs, wellness programs, intervention plans through insurance plans, and just be consistent in that messaging ongoing. Right now, for example, there's a lot of people suffering because holidays are coming around. Just having a pulse on people and just worldly affairs, a lot of different things that you can keep your eyes on to just be there for all members of your staff.
Thank you so much. And I think, one thing that's really important is I hate differentiating according to status, but you really did point out something important, that it really does have to start from the top. You do have to have the leadership of any business, nonprofit, government entity really supporting this. It has to spread every which way throughout the organization, starting at the top, I think is really important. Michael Orth, I know you have some responses to this as well.
Yeah, just to build on what Tanika was saying, I think it's important that everyone understand we're talking about the mental wellness of all employees, not just a few that may have come forward and who are struggling. We're talking about creating a supportive organizational culture that normalizes conversations. And just as we offer gym memberships, or we have how to respond to choking, that we really promote mental wellness and health. We talk about it. We put signs supporting 988 across our businesses. A lot of what we're seeing organizations and businesses ask for is sort of trauma-informed supervision and management. How do we recognize early signs and support people? How do we build safety and trust within our work cultures? These are things that are, as the county executive, I think Mike said, are part of a public health approach, including mental health as well. And then, of course, it's important to really, do employees know that they actually have an EAP program? And it's not just intended when you're in crisis, but when you're struggling with other issues or challenges, or seeking some guidance, that are EAP programs, or there's awareness that they're robust, that they're providing training as well for the workforce. And I think it's imperative that any plan includes measuring and improving workplace well-being, that we have wellness committees and getting feedbacks about how our plans. So all of those factors are really important, but it's really creating a culture and really
Everybody
promoting
mute
mental
themselves,
wellness for
please.
all employees.
Michael, Romita, or Angela, do you have anything you want to add to this?
Well, I'll start with what my grandfather used to say in a heavy Italian accent that may apply to a broad variety of circumstances, but certainly what we're talking about today, mental health in the workforce. The fish stinks from the head. So setting a corporate culture, the boss on down, in being welcoming and understanding of some of the mental health, you never know what people bring into their workplace from their home lives. And we all have different challenges. So of course there are limits. Employees are expected to show up for work, ready to do their jobs. But if you have a culture of understanding, that can certainly be a place to start. And there are also some practical, significant steps that corporate leaders can do when they're dealing with their staffs. Things like set reasonable expectations for people's work, have clear goals, be supportive, and also be consistent in how you deal with individual workers. Try to recognize the signs of burnout and stress early and intervene when necessary rather than letting things kind of simmer out there. So those are some practical takeaways.
Michael, I think your Italian grandfather stole that quote from my Jewish grandmother because I grew up with that.
Grandfathers and grandparents everywhere, imparting their knowledge, even down through the generations.
Wow, that's great. Angela, do you have anything you want to add to that?
I just wanted to add something really simple, and it could be for the director, for the supervisor, or just for peer-to-peer in the offices. Just checking in with someone, just actually checking in and saying hello and how are you? Generally meaning how are you?
Yeah, just
Yeah, it goes a long way.
for sure. Sometimes the simplest things can have the deepest impact as well. So thanks for that, Angela. So going on to the next question, and if you do have questions, if the participants have questions, please put them in the chat and we'll get those answered as well. Recognizing that mental health challenges don't start and stop at the workplace door, how can partnerships between nonprofits, businesses, and faith or cultural groups help promote both individual and community well-being? Michael, Orth, I think I want to start with you on that one.
Yeah, thank you, Jen. And, we've talked a little bit about how only 20 to 30% of individuals, adults seek professional help, and they wait so long to get help. So who do they naturally turn to? And it's, as we're saying, it's our hair designers, our barbers, our houses of worship, our schools. And what we've tried to really do in Westchester, thanks to the support of all the organizations, is really to bring those connections that businesses are familiar with their local houses of worship, their local mental health or advocacy organization, who they can partner with. One of the things in Westchester, many of you are part of our faith mental health affirming directory, where we have clinicians who are faith affirming and are comfortable working with businesses, working with folks who want to seek more of a spiritual or religious relationship. So it's important that organizations know that these resources exist out there and how to access them. Definitely important to connect with your local organizations that can help support the work and, more importantly, support your employees.
Mm-hmm.
Michael, you bring something into the conversation that I think is important, and maybe others can comment on it as well, that today, we're not just talking about mental health support in terms of therapy, that we recognize now that there are many different ways that people can get help. You spoke about the faith community. And so touching on that, Tanika, Michael, anyone else, about just the importance of recognizing the different ways that you can support or people need to support their wellness. Any comments on that?
I'd like to say that I don't want to use the word marketing, right? When we use marketing in business, we're trying to, we're looking for an ROI on that. So I don't like to use the word market, but I would like to say just continuing to bring awareness in all arenas is important. And I appreciate what Angela said earlier. I actually was driving over my bridge as I was going home, and it said, there is help, and it it gave me hope. It made me feel good because I know what, obviously being a member of that community, what happens on that bridge. And I was so happy to see that signage. So I think that if we continue to advertise and promote, what our goals are and our objectives are when it comes to mental health support, no matter what it is, whether it's a mental health, an event, suicide, thoughts of suicide, or any of the above, that we continue to just promote awareness. I think that people, there may be awareness, but it's just, it comes in pieces and pockets. And I think that, that connected to the stigma kind of creates a barrier for people to go out and seek support. And as we talk about today in terms of cultivating relationships and the workplace, I'm a big, my management team will tell you Tanika's always in someone's office. Someone's always in my office. I just talk to everyone, and I kind of know when something's going on for the most part. But I care so much about people's well-being because there's been so many shifts in why mental health occurrences have taken place. There's generational shifts that are going on in the workplace. You have older generations that may feel a little threatened by younger generations. There's AI technology where people are feeling like they're being replaced. There's teenage issues that parents are dealing with, or marital responses. People are still dealing from COVID. There's a lot of different things that people are going through, and I just think that continuing to raise awareness, and you're right, not when there's a crisis or not when there's an open enrollment, but kind of a constant flow of communications that go out and say there's someone here to help, or an open door policy, or you know you can come here and you can talk to me, or maybe passing by someone's desk and seeing a different look on their face and saying, hey, you want to have some tea, is everything okay? It goes a long way.
Anybody else want to add to that? Okay, I also think this particular collaboration is really great. The county executive was thoughtful enough to bring business, nonprofit, and government together. And then that day received an email from Michael Romita that said, let's do something about this. And it went from there. So there are things that all sectors can come together and collaborate for. And I think this is going to be a really good shining example of a collaboration that's going to make a big difference in our community, or the start of a big difference. Michael Orth, did you want to say anything else on that?
The only thing I just want to add is everyone on this call really plays a critical role in supporting each other's mental health and wellness. And it really starts with ability of engaging someone who may be struggling. And it really starts with a non-judgmental approach. More importantly, having the vocabulary that invites conversation, and then knowing some of the resources. And if you get anything from this afternoon, it's just knowing 988 is available to anyone who just may have questions or who's struggling. We do have some resources that were highlighted. Mental health first aid is sort of the CPR of mental health that teaches you the skill set, the vocabulary, and we offer that to folks who work with youth, which is called youth mental health first aid. We have teen mental health first aid that provides that same training for teenagers. And we also have mental health first aid in the workplace. So it's part of a national training division. So if you have any questions, reach out to Jen or myself, and I know we'll follow up. And there's also organizations like NAMI Westchester, that's people with lived experience, peer-to-peer support, or I see many of my friends who are part of local organizations that feel free to reach out to. So we all play such a critical role, and we could possibly be saving lives as well. So thank you.
Yeah, do want to point to a couple of other questions. Is there a less clinical approach towards obtaining aid for individuals experiencing these sort of ideations?
Well, there's many forms of treatment. Many folks now are turning to mindfulness, other forms of treatment. There's a curriculum called Soul Shop that's really for folks who are more engaged with religion and spirituality. And then there's the more traditional approaches, DBT, other, that are really resonate with a lot of folks. So on the good side, there's a lot of different approaches, and it's really whatever works for that person or that young person. But there's many forms of so-called treatment that people find helpful. Angela, I don't know if you want to add anything to that.
Yeah, I just wanted to add, with the overall 988 experiences, thinking of it as, it's not a therapy session per se, it's a casual conversation providing support. Should that individual want to move to the more therapeutic session and referral, we're happy to help you, but I would think of it more of like a casual conversation. And also, we have some, I should call them some known callers. We speak to some of the same individuals every day. They're not quite ready yet to move to that formal therapeutic session. They just want the support, that anonymous support from us every day. And so we've got to know some people very well in the community.
And I think in the workplace as well, we've spoken about this, that there were so many opportunities and ways to advance wellness, and it's not always therapy. It can be yoga, it can be different things when you get to know each other, how to advance wellness and calm, and having a lot of different options open to you. I do want to, somebody asked, can we schedule a day for our staff to come to a class about mental health, like a CPR class? Yes, you can. So there are 2 more programs in this series. The one on December 1st is about cultural competency related to the Hispanic and Asian communities. And then on December 8th, or I may have reversed it, and then on December 8th, a teaser about mental health first aid, which is the CPR for mental health. And through the Westchester County Association, NPW, and the Department of Community Mental Health, we will be making announcements for at least 2 classes free classes on mental health first aid training. So we will get that to everyone. So Dan, thank you for that question. I don't.
Jan, I just want to add, I love the way we frame this as mental health first aid, and particularly in the workplace environment. Look, if an employee is missing time in the office, whether it's mental health or a broken foot or, a virus or something like that, they all kind of affect productivity in the same way. So this is really no different than sort of dealing with a kind of a standard medical issue, and it should be considered as such.
Thank you for that. Ruben asks if there's a flow chart available that we can perhaps print out and follow it in a procedural manner. In terms of dealing with a colleague that might have a mental health situation or crisis, again, that's mental health first aid, provides really step-by-step and also just important tools to use when interacting with others who might be in that situation. And also, we will share resources with this group in general about different opportunities to advance health and wellness. I'm going to jump back into the questions, and this is for each of the panelists. Let's look to the future. What gives you hope where mental health awareness is heading, and what still needs to change most urgently? So why don't we start with Michael Romita?
Well, in some fashion, you're looking at hope on the screen. I mean, Westchester is so fortunate to have a professional community that comes together for circumstances like this. And even if you are just framing this in the cold-hearted context of the economy, you look at the importance and the contributions to the economy by the nonprofit sector, often overlooked, unfortunately, but ways that all of our organizations can be working together to talk about these issues. We talked about the stigma. We talked about how this is becoming more and more accepted in the workplace. And just the fact that the county has these structured resources to share out, and we all have to do our part to make sure that happens.
Great. Tanika.
Thank you for that question. I echo Michael there. I was just thinking about hope, and I think that my answer to that is what gives me hope is when there is genuinely a response and recognizing that mental health is just as important as any other thing that we deem important. Um, and I think that's it, it kind of like, I always kind of say, okay, let's stop, let's hang on to that a little bit, is when we really genuinely recognize that mental health is important as any other thing that we believe is important. Um, I'm happy to see, in my role, I'm happy to see insurance plans are covering mental health more comprehensively, such as unlimited therapy visits. I'm happy to see access to virtual support. Um, I'm happy to see initiatives such as 988, 311. Those are the things that I just say, hope is, I hope that we can continue this because I believe that it's only going to continue to expand as time goes on. And being in the workplace and being an HR person, I associate myself with all of my staff individually. And it takes a lot of time and it takes a lot of work and a lot of effort, but I'm passionate about it because I think it's important. So just as well as I can sit down and talk to someone about a review and say, hey, listen, you may have fell short on that project. I still like to sit down with someone and say, I'm really sorry that, your pet may have, they may have lost their life, or there's a situation that someone is dealing with, just so that that person can come back brighter and feeling good about the place that they work, that people care. And that's where I am.
Angela.
So similarly, what gives me hope is a platform like this, where over 200 people registered. A recent event we had with the Portchester Chamber of Commerce, I believe there was 200 people who registered. But that's a huge number, and that's an increase from many things that I've been on before. Hope is also that teeny little 12-inch sign that I saw in the Staples parking lot. That for me is hope right there also. I think the second part of the question was where we could see improvements. I think it's working together. We have so much in this county, and I think we just really need to work together. Even here, if you take something small like St. Vincent's Hospital, we have so many different departments. And sometimes we all function separately. I think people just need to be working together. And so all of us on this call working together and connecting. And I'd like to put my email in the chat too, if there's anybody who has questions or wants to connect after this, so we could work together.
Yeah, thank you for that, Angela, because I didn't want to offer that up to give you more work, but presentations are so important, and you can consider bringing them to your workplace as well and expanding it out. I'm just trying to see if there are any other questions, but I do want to end with our Commissioner of Mental Health answering this question, and also highlighting some community resources. We're putting some materials together that we will get out to this group as well. But Michael, somebody also wants to know about a little bit more about the mobile crisis unit. So if you could start with that and then share your response and, any resources that are available immediately. And then, of course, we will be sending out some resources as well.
Yeah, thank you. The question regarding the mobile crisis response teams, thanks to our county executive, our board of legislators, when we were looking at reimagining police the entire country, Westchester specifically pulled together a committee, looked at the primary issues related to mental health crisis, and out of that came Project Alliance, was really respecting our first responders and law officers, but recognizing that they can't do it alone. So we created 8 mobile crisis teams that are embedded within police, 911, first responders. So when the intervention is more appropriate for mental health, they will co-respond with police, or they'll go out on their own. And the team includes mental health folks, peers as well, to have a more appropriate response, and also follow up with people that may be in a mental health or substance use distress. So they're alive and well and growing, and each of our police departments have access to them. And that's what gives me hope that we have created more partnerships, as my colleagues have said, police are more responsive. We just had a meeting with the Judge and Lawyer Association where that was the primary point of conversation. Last week, we were invited to the New York State Parks and Rec Conference, and one of the priority areas were mental health and how we support each other and the people that we serve. So there's definitely a more of a normalizing of the conversation. And I think what we can do more is just model it on a day-to-day basis, being more vulnerable about our own mental health and wellness, and just normalizing the conversation. And then keep pushing those commercial insurance for parity for mental health as well. While we have made a lot of strides, and thanks to our governor currently, she's really pushed commercial, there still seems to lack equity in terms of access to mental health services. And we definitely look forward to pull together some resources, and I know Jen will follow up with some information as well.
Yeah, and there's some information in the chat. Our colleagues at Mercy University and Westchester County have put some information in, and we will be sure to send out the resources as well. Somebody did point to, are there 988 centers? Will 988 assist participants or clients who live in Putnam, Dutchess, Rockland, Ulster?
Yes, I was trying to answer that in the chat. So every county has their own designated call center. As long as someone has a major cell phone carrier, it'll get routed to that call center. There are some few that are not up and running yet, so they have what's called a backup center. Again, Suffolk County is one of the bigger operations, and so they back up a lot of call centers. So for example, if every crisis counselor on our team happens to be on a call, it will go to the backup center so that call is always being answered. But every county across the nation should have or is developing their own call center.
There are a couple more questions that I do want to ask. We know it's important to provide resources for our employees, but what is suggested for business owners themselves to get support if they struggle with their own mental health? I'll throw that out there. I mean, the same resources that you provide for your employees, you should consider utilizing yourself. You need to, it's put the oxygen mask on first before you can help others or run your business. But Tanika, Michael, Orth, anyone else want to answer that?
Yeah, I'd like to say, the message is across the board. There isn't a difference in conversation or a difference in approach as to who it is. I think that leaders, however, may be even more hesitant, right? For example, for a leader to come to me as their employee, their HR person, but I'm still their employee, to come to me and reveal something that's very personal. So that weight may be on, I say, the HR professional or team who's handling that mental health focus, right? To establish that there's confidentiality in their approach as well as anyone else, and that it's separate and apart. And thankfully, I will say that like my people will come to me and will talk to me and say, hey, listen, or again, it's cultivating those relationships and that relationship of trust, where even if you slide them, here's a phone number, I'm just giving this to you today because I sense something, or I may not know what's going on, or you may not feel comfortable speaking to me. So it's about just kind of having conversations and having some empathy and having an approach, but it's really all the same. No one has a different call center as to who they seek support from.
Yeah. So I'm going to hand it back over to Michael Orth to close us out. And just with a reminder, we have 2 other programs. We'll be sending out plenty of information about that. And with big thanks again to Angela Jacobs, that was a great presentation. Tanika, you're always spot on. Michael Romita, again, for getting the ball rolling, and a thank you to Jill from the County Association, Suzanne, Elijah, and Amy from NPW for working on this. But Michael, close us out. Thank
Yeah, thank you. So much to absorb, and so many opportunities. I really want to take this opportunity to thank all of you for spending the last hour and 15 minutes to learning about mental health and wellness, to improving outcomes in our county. And again, there's a role that each of us has to play, whether we're providing direct services, whether we want to improve our skills, and definitely supporting the workplace and businesses. So please take advantage of any opportunity. We'll definitely share information, and we look forward to a continued partnership. And just thank you for your time and your commitment to really support the mental health and well-being of our residents. So thank you.
Thank you,
Thank you,
everyone.
Michael. Thank you, everyone.
And thank you to our county executive again for getting the ball rolling with all of this.
Thank you.